Consultant physician and infectious disease specialist, Dr. Gertie Anyanwoke, joins me from Louisiana via Skype to discuss this. Good to have you join us, Dr. Anyanwoke.
It's my pleasure to be here. Good afternoon over there and good morning to the people in the U.S.
So before we narrow down to Africa, let's look at this on a global scale. We're seeing countries like Indonesia, Hong Kong, we're seeing, which is a district of China. We're also seeing countries in Africa like Uganda and South Africa, and as well as Russia, all reporting high number of cases. There is a surge of cases in these countries, and it has all been attributed to the Delta variant. So talk to us about this variant and how deadly or how worried we should be.
Thank you. The Delta variant has really been concerning. That's the variant that was first found in India and was associated with a lot of the cases that they had in India recently. Now there is actually Delta variant plus, and that's of interest, and they are still investigating it. It's a variant that has emanated from the Delta variant, and that seems to be going around the world. It's in UK, it's in the US, and it's in a few other countries, including South Africa, Uganda, and others in Africa. That variant is actually more easily transmissible than the B117 that emanated from the UK. It seems to be, because it's so easily transmissible, it gets into many people, and it can get to more people that have comorbidities, and of course, the rate of death may also go higher. However, the vaccines that we have had here in the US, precisely the Pfizer vaccine, and even AstraZeneca vaccines seem to be holding up well against that variant strain, including the Moderna vaccine. They seem to be doing very well over here. There's some areas, pockets of areas that are associated with it. A lot of it is younger people that haven't been vaccinated yet. People that have had COVID have some protection, but definitely people that have gotten the vaccination themselves are going to be well protected.
And it's good you mentioned the fact that because people have been vaccinated in the US seems to be holding up well against the variant. But when you look at a place like Africa, where apart from South Africa that just announced a new round of restrictions because of a surge in cases, most African countries have now let down on restrictions. And then we've seen that most African countries, in terms of vaccination, have not vaccinated up to maybe 4% of their population. So how will this impact the continent?
You know, when COVID first started, people looked at Africa and looked at our health resources and felt like COVID was going to hit Africa really bad. It did get to us, but it may not have been in such proportions as it was thought initially. So at this point, we can only hope that that will be the case again, that it will not be as deadly as it has been in other places. We'll just have to wait and see. But my advice to people is, if you can still use those protective measures to mitigate, wearing masks and washing hands frequently and social distancing, they still help a lot. And if you can be vaccinated, go get vaccinated.
Should we really wait and see, though? And you talked about getting vaccinated. The vaccines are not really even that available for those who have. The process is ongoing in a place like Nigeria, and people should actually take the vaccine, but it is not available. We don't have it here. There's a global vaccine shortage. So should we really wait and see? What should African countries should be doing now, apart from just wearing masks? What are that sort of restrictions would you like to see in terms of ensuring that this Delta variant doesn't become a dominant variant in the continent?
The restrictions are similar to what we've had before, but remember that all this have been tried in African countries. There is no one size fits all. Every country has their own situation. We saw how disruptive it was to commerce and a lot of people's livelihood. I believe that the health authorities of the countries should take a look at the human impact that it will have and make corrective measures. But it's at this point, it's really a little difficult, being that we've been through the first wave, the second wave, and this will be the third wave if it gets to precisely Nigeria. I know countries like South Africa have given more restrictive measures. Even in the UK, they have given also more restrictive measures. We would like to see a situation where Nigeria is, upfront on this, but I'm sure they are watching and would make the right decisions at the right time.
We'll see how countries in Africa respond to this in the coming days. Consultant physician, infectious disease specialist, Dr. Gertie Anyanwoke, thanks for talking to us.
Thank you for having me.